Hi, my name is Danny Aronson and I'm Tune CEO. Tune is the first comprehensive hearing benefit for employers and employees offering hearing health solutions from prevention all the way to intervention. We are the largest online group of audiologists in the US, operating in all 50 states and serving tens of thousands of employees. In this new series, we showcase some of the incredible solutions offered at no extra cost or out-of-pocket expense on the Tune platform. Today, I'm joined by Dr. Heather Malyuk, Tune's head of audiology, and Eric Willis of Eargo. It's great to have both of you here. Eric, why don't we start with a brief intro and perhaps you could share with us what is Eargo?
My name is Eric Willis. I'm the general manager of Eargo. We're a direct-to-consumer hearing aid company founded in 2010. Our mission has been making hearing solutions accessible to as many people as we possibly can. I think that you will know that hearing loss is a disease that many people have, but not a lot of people are willing to do something about it. And statistically, I think the average age or the average time that it's taking folks to address their hearing loss is something around 7 years. And our mission from the beginning is making products that people actually want to wear and want to use.
That's awesome, and I can attest to that. I have moderate hearing loss, and on this call, I'm using a great new Eargo product called the Eargo Link. Here it is. Here's the box, if you can see it, and they just look like regular earbuds, and they're a fantastic product for somebody with moderate hearing loss like myself. So kudos on a really great addition to what's already a great product line.
Fantastic. No, it's nice to see you wearing our product. You showcase it well. And I can barely see they're there too. They look like a pair of earbuds.
Yep.
Very nice. Eric, I'm so glad you could join us for this series. And do you want to dive into nitty-gritty about Eargo? You mentioned when you got started, but what all can you share with us?
Go ahead, and I'm going to put a couple slides up on the screen and walk through it, talk a little bit about hearing loss. And firstly, for the audience, I'm not an audiologist. I'm a business person, so take my description of some of the technical features as that. But I think our data here and the slides will show a lot about why hearing loss is important to treat, as well as benefits of Eargo. All right, so hearing loss. Hearing loss in the United States. 15% of adults age 18 and over have some sort of trouble hearing without a hearing aid. And this is all data, but as you get older, up to about 25% of the population, once you get in the sort of the 60 to 69 range. It's major concern worldwide. I think the worldwide estimates are around 2.5 billion people have some form of hearing loss. I think the way to speak to it on lay terms is, all of us know someone in our lives who has hearing loss, whether it's a partner, whether it's a parent, whether they're coworkers. It's just one of those conditions that many people have. And unfortunately, not a lot of people are willing to admit or are ashamed about it, and they don't need to be. So, is hearing loss important to treat, or what is the impact of untreated hearing loss? Well, there's been increasing data that's come out that shows that it has a pretty strong effect on physical health, health, and also social health. Health meaning isolation has been shown to be an increasing for people with untreated hearing loss. I can speak to a little bit of some in my family that have some family members that have had some hearing loss that's untreated, we think has led to some dementia in them. So, it's something that people need to treat early, and we don't. Lots of negative downstream effects. Aid use can improve those outcomes. We've seen data that this actually, I'm going to go ahead and jump forward through this slide. It's sort of redundant. So why, this is probably easier to speak to, is, do people not want to treat their hearing? It's, really about stigma. It's, people think of hearing aids being, devices that are, they're typically bulky, they're flesh colored. They essentially mark people as old. That's the traditional way of thinking about it. And it's not right. And so you think about in today's world where getting more and more used to wearing things like AirPods or things like that, it's getting less so, but still there's there's a lot of social stigma around devices for treating hearing, and we're trying to remove that. And think about it in contrast to eyeglasses. I always think about eyeglasses. It's a medical condition like hearing loss. People that have issues with seeing either nearsighted or farsighted. It's taken a very long time for people to get comfortable wearing eyeglasses. And so I think it's only in the last however many years that you now see people wearing eyeglasses that are for style. And I'm hoping that we get there for hearing. So what do we offer? So we have a line of virtually invisible discrete hearing aids. Here, I can show you one. I have one sitting right here, if you can see it on the screen. They're very small. They fit almost entirely inside your ear. You can't see them. And in fact, I'm actually wearing a pair myself. Is wearing a pair of our, I actually have, these are our Eargo 7s. These are the ones that are designed to fit almost completely inside your ear. They're for mild to moderate hearing loss, and we strive to make them as easy to use as possible. So you can change the settings and personalize these devices with both you can tap on what's called the tragus. It's this little nub that comes out of your ear. You can tap on them to change the settings. You can also use the app and change the settings within the app. I also have where's my charger? Sitting on the desk. It's so small, I almost missed it. Our charger is this small little puck. It can fit inside your shirt. The device themselves, they sit in the charger like this. It's something that's designed so you can take anywhere you go and be seamlessly into your life. The other thing that we offer is that, this pertains well to the clients of TuneCare, is that because we are a company that is kind of come on the scene with offerings in our call center and help center, we can offer the same experience to your clients anywhere in the United States. We've been doing this since 2012 and have a lot of experience with direct to consumer, both in terms of just awareness about hearing loss, but also about the training and support and customer service. We've been doing this a long time, direct to consumer, so well positioned for that. And then lastly, we have a US-based team that does customer support for the lifetime of the product, everything about how to use the devices, tune the devices, just any questions. We have a team of experts that have a mixture of backgrounds, everything from audiologists to hearing instrument specialists to people that have backgrounds in customer support. So we have long prided ourselves as having a very solid customer support offering for our clients. And so lastly, I'm going to flip to a slide. This is some data we published about a year ago that talked about something from Eargo's clients. So we did a survey and we had 884 people responded. The really interesting thing is that unlike this category or some of our competitors, 70% of the people that have come to us were new to category. So new people that have never used hearing aids before. We see this as a huge success. You think about the people to do to hearing, this number here shows that we have basically broken the barrier, and most of the people that come to us have never used hearing aids before. So this is a huge win for us. The other thing, not obvious, but the people that have come to us have a desire for invisibility, the aesthetics of the device. These are folks that don't want to be seen as having a device behind their ear that's invisible. I mean, think about it in a company setting, workforce. So much of our time in meetings and Zoom calls, and to being seen as, or even just having the insecurity of having a device that someone can see behind their ears. There is a lot of interest in the invisibility or not being seen as wearing a hearing aid. And so just like today, you can't see the device that's in my ear right now. 50% of clients have come to us specifically for that desire for invisibility. The other interesting point of data is, about for searching for hearing loss. A lot of these folks have already talked to their physician. They've either come to see their primary care provider or they've seen a hearing professional first. So, these are folks who are interested in doing something about their hearing, but they hadn't done it yet. And then lastly, because we're talking about over-the-counter devices, 75% of our respondents basically say that the Eargo hearing aids are performing as well, if not better, than a traditional hearing aid. When I say traditional, I'm really kind of talking behind the ear devices, what people traditionally think of as a hearing aid. So we're thrilled to be able to show this data that says our devices being smaller, invisible, and easy to use are just as effective, if not more effective, than the conventional hearing aids. So those are the slides that I have. Let me figure out how to unshare my screen and I can talk to you, look you guys in the face now, because I was not looking at you, I was looking at my slides. All right, so now I'm back. So there's our summary. We have a line of hearing aids that we have for sale. Eargo 7, we have Eargo 6, we have our newest, which are the Eargo SE and our Eargo Link. So Eargo Link is what Danny is wearing. Those are our earbuds. Those are designed for more of like occasional wear. Like if you're going to wear them in meetings or if you're going to go out to see a movie. These are folks that like you would kind of a standard earbud, but their hearing aids are very good hearing aids. They have noise cancellation, the music, Danny, I'm sure Danny is streaming the conversation through them. They're top notch. Our Eargo SE is our signature essentials. These are the hearing aids that are very use, and they have levels of sound processing. And I'll jump forward to our Eargo 7. These are our full feature hearing aids that allow customization with really everything that a customer would want to do, but they're very hands-on. We have lots of settings in them for be able to adjust for ambient noise, whether it is individual profiles. I mean, these are our full-featured hearing aids for the discerning professional. So there's a kind of a product line.
Awesome.
That's the Eargo story.
I love it. And I have just a couple of follow-up questions for you, just to give a better idea of the partnership here and how someone kind of guys. I think what's really unique and wonderful about our partnership is that on the tuned side, we have a audiologist doing a triage. We members who are benefits members, we talk to them, we do the hearing screening, and we really go through various screeners to see what exactly would be a good fit for them. When we send someone to Eargo, it's because we think they will be highly successful. And I think that's something that's really unique about the partnership. But what I wanted to ask you was, in the world of over-the-counter devices and hearing aids, aside from just being so discreet, what else makes Eargo stand out, do you think, in terms of the app technology or, what end user might experience?
Yeah, I get a couple ways that I think that were unique beyond just the form factor. And the form factor is the easy thing. Most people that come up to us in conferences say, wow, it's so small, I can't even see it. It's great. That's the primary selling point. The other I like to describe, and again, I'm not an audiologist, but we packed all of the features and the power of a conventional behind-the-ear hearing aid into a very small, very, very tiny form factor. So you're sacrificing nothing. That is from a product level, we offer. Ease of use also, of course. You can, if you like to work with apps, we have an app that does all sorts of, adjustment. But if you don't want to use an app, you can just tap on it and change the settings. So we really try to make it accessible for anybody. Same thing with the process. And I got more on our consumer people that come to us as people where they are, whether they want to talk to us on the phone, whether they want to talk to us on Zoom, whether they want to do all of the transaction communication online via email or through our website. We meet the customer where they want to be. That's been very important to us. And then lastly, it's related. It's the support. I mean, the products you buy today, you buy it and it comes in, one of those large online retailers, and boom, you can't get a hold of the company. You have to, hold forever. We don't do that. We have a team in Nashville that is accessible most of the hours of the day in the United States time zone, because we're a US-based company. We have long made customer support a foundational principle for the company. So those are I think the three main things that set us apart.
Wonderful. I want to give you an example and ask a question, and I think I already know the answer, but I'm going to ask it anyway. I'm picturing in their 30s. They might have mild hearing loss. They're working their job. They get up in the morning, they work out, they go to work, they go out after with their friends. Can Eargo carry them through the whole day on a single charge?
Yes.
Okay. That's a question that actually comes up quite a bit. Fail day. It's not the case. Even though these are tiny, they're going to get someone through their whole day, through drinks for friends and everything else, and then do it again the next day. I was curious, Eric, do you have any favorite phrases or examples that anyone has said about Eargo, about how Eargo has changed their life or helped them in any way? And any specific examples that stand out?
Trying to think of any good. I mean, I've got a list of quotes that we have our marketing team has pulled together that I can share. I don't have them off the top of my head. I just think of just examples of people that there's a kind of family that bought a set of Eargos a couple of years ago, and it's just changed his life. It comes to events that we have at the house, parties or whatever, he's wearing his Eargos. He's showing them off to my friends. I mean, I'm amazed that this sells itself. I mean, the I said before with the slides is you have to convince people that they need to do something about their hearing. That is the hardest hurdle that we have, and I know you have. Well, but the people that have taken the plunge, that have become Eargo customers, are just. And I think of my friend. He's going to be here tomorrow for the 4th of July party. He's probably going to be wearing his Eargos. He's probably going to be showing them people how it works, and those are the things that make me get up in the morning and say, this is why I'm doing what I'm doing, is that it's making people connected. Connecting about workforce. You talked about someone who's 35 to what the age is I think about back to the example of we're all meetings, and the model has put such emphasis on collaboration and communication. I mean, why do we Zoom with the camera so you can read facial expressions? I mean, you have to be able to have that, whether it's in Zoom or in person. And hearing the reason to talk to you and not feel weird about having something here. And to be clear, I don't have hearing loss. I don't have them powered on because it allows me to focus a little bit better. But I don't have any sense of awkwardness of something that's visible. And so when you're in a meeting and when you're on Zoom, I mean, that's a huge part of the modern workforce, is that face-to-face interaction with, whether it's Zoom or in person. That's really where I think we are strong suit is.
Yeah, I agree. And I think with hearing loss or hearing issues being an invisible thing, I think often companies, employers and employees, they don't realize it's there for colleagues or for employees, and being able to offer them a benefit where they can get help and feel good about it is so important too for the mental health aspect of working. So just everything you said, spot on.
Yeah, I mean, think about disengagement of play. You talk about it being a invisible thing, and also something that people are very good about hiding. And and because spent enough in this category, I can see when people are reading my lips. I can see when people are listening to me, but they're really looking down my mouth. I know that from some family members too, and that is all disengagement. And I think of even our company, we do engagement surveys. I think a lot of companies do engagement surveys. Engagement is such a powerful word in the corporate world at this point. Hearing loss is disengagement, just fundamentally.
100%. And I think one of the things that we're seeing when we talk to benefits people or HR people, a lot of times the response I'll get is like, and I'll say, that anywhere between 20 to 25% of your workforce has some sort of hearing issue. Definitely. Does not necessarily mean that they have severe hearing loss, but they might have some sort of hearing issue. And the response is huge surprise. And but nobody's ever come and ask me. And I'm like, it is very, very difficult for somebody with even mild to moderate hearing loss to come to you as the HR person or benefits person and say, I have trouble understanding what you're saying. To ask coworkers to repeat what they're saying. So what happens is they just ignore it, or they just miss what's being said, or they finish an 8-hour day of work where their mind has to do so much work. We always give this example of, if I do this conversation without my eyeglasses, I can still see you guys, but I need to squint.
You're going like this, yeah.
But I'm going like this. Even having mild to moderate hearing loss is the hearing equivalent of squinting for 8 hours.
Yeah, we're doing
just
this
to be able doing this for 8 hours, just to be able to understand what people are saying. And I think a couple of things that I kind of want to what you said. Invisibility form factor for the working age population, I think, is a really important element of it. I think there's something about the ease of use of Eargo, the fact that it's very contemporary, it's very modern. For people around those ages, we're very used to doing these types of things. It's very intuitive. The ability to do self-fitting, the ability to do programming, the ability to kind of around with it, I think is incredibly useful. Just to give again the kind of the audience the sense, once the company adds tuned as a benefit, the member will go through an online screening, then will go through an online consultation with an audiologist. And if the audiologist perceives that Eargo would be a great solution for them, they would simply get a pair of Eargos without any out-of-pocket expenses, any additional costs, literally delivered to your home, typically within 2 to 3 weeks. And then you can have the support either of the Tune team or of the Eargo team. Again, because I think you touched on this, and this is why Eargo is so, and the emphasis on customer support is critical. It is not like glasses. It's not just something that you put on and you 24 get used to it. There is an element of getting used to it and learning how to live with it. And I think Eargo does a great job of really kind of accommodating people and getting them to have a great experience with the product.
Yeah, and the way I've always thought about it is, I'm biased, of course, but if you have mild to moderate hearing loss, and our devices are indicated for your condition, why would you not choose Eargo? There's no downside. I mean, we have a very generous return policy. If you have hearing loss, there is no reason to not try Eargo as your first line. If you have severe profound hearing loss, yes, there are some other solutions that are more suited for your condition. But for someone who has mild to moderate hearing loss, particularly in a workforce environment, there's no reason to not try it.